Hi, and welcome to Something to Talk About. Tonight we will be talking about prosthodontics, but before we get to that, I would like to welcome everyone. And if you have a question tonight, please feel free to give us a call. We are live this evening, Wednesday evening, so give us a call at 781-270-9199. I always forget that number. So 781-270-9199. Or if you have any suggestions for future topics, if you think of a question after we're live and you want me to get in touch with our guest, you can feel free to email me at talk@bcattv.org. There, business aside. I would also like to thank my crew. I have helping me tonight are my staff members, or the BCAT staff members. They're not my staff members. Mike Duvall and Corey McNeil, who, with the help of a few other people, pretty much run BCAT. I would like to thank my volunteer staff, volunteer crew, Forrest Knowles, Phil Arcaro, and Mike Shipka for last minute coming in because JT Marchant and Colleen Moore, my regular crew members, were unavailable this evening. So Colleen, I hope you feel better. JT, I hope you're having fun wherever you are. And thank you, Forrest, Phil, and Mike. One last thank you to my husband, Paul, for staying home with Gwyneth and Evan for Daddy Date Night. Gwyneth and Evan, I hope you're having fun. And let Daddy read you your Batman stories and then go to bed because we have a busy day tomorrow. Okay, and I think that's it for all of my official business. Now, tonight we will be talking about prosthodontics and general dental care. And with me tonight is Dr. That sounds so official, Dr. Pamela Maragliano-Muniz. Did I say that right?
Yes, you did.
Okay. It's like one of those words that doesn't quite...
Never ending, yes.
Yeah, your kids are going to hate you in kindergarten when they have to write that out.
Yes, they will.
Well, welcome.
Thank you.
And thank you for coming with me.
Thank you for having me.
And I have my little cheat sheet of questions because during the course of our conversation, if we get sidetracked, this will help us come back to focus because I kind of have the tangential short-term memory. So, but enough about me. Tell me a little bit about you, where you grew up and where you went to school, family, how you got into wanting a career in dentistry, and how you decided to specialize in prosthodontics.
Okay, well, I'm originally from New Jersey, so that's why I say talk and floss and dog and things like that. But when I was in about 5th grade, my parents moved to Orange County, New York, and I went to school there. I started off in the community college. I wanted to major in ice hockey, and my dad said no.
Ice hockey, dentistry, well, they're both teeth related, you know.
They are teeth related. I did decide if I lost a tooth, I would quit, but fortunately that didn't happen.
Again, bad joke entering, you know.
Exactly.
What do you call a hockey player with all of his teeth?
Ooh, what?
A rookie. Okay, bad joke. Little tiny joke about that.
No, I like it. It's good.
Continue.
So, starts with my sister. She wanted to study music and become a Broadway star, and my dad said, no. Patty, no. You are going to become a dental hygienist. So, don't ask me why. I still to this day don't know.
Okay, I'm just wondering if like he was a dentist or something. Okay.
No, not at all. His hygienist must have had a really empowered day, and he decided dental hygiene was the best job on earth. So my sister off to hygiene school. It's my turn to come around, and I said, well, I want to be a hockey player, and I want to study something. I'm not sure, but in the interim, I'll play hockey. And he said, no, you are going to become a dental hygienist too. So I said, okay.
Diversity in the family.
Yeah, exactly. We just push them out in the family. So I said, fine, whatever. And I went to dental hygiene school and absolutely fell in love with it.
Oh, cool.
Yes. So my sister graduated.
Dad was right.
This is on TV. I am not admitting to that.
Okay. Dad was right about this.
Okay, about this. So basically, my sister graduates 3 years before I do. Graduation is starting to embark, and I said, okay, why don't you quit your job and let's go get our bachelor's degree. So the both of us went off to Boston.
Now, as a hygienist, 2-year associate's degree?
You can get an associate's degree or a bachelor's degree.
Okay.
And so the program that we went to was an associate's program.
Oh, okay.
So then we decided to finish our bachelor's degrees together at the Forsyth School for Dental Hygienists, which at the time was affiliated with Northeastern University.
Okay.
So at that time, we both moved to Boston, go work as, hygienists while we're studying. My sister's working for a prosthodontist. I'm working for a prosthodontist and a general dentist. And
Was that just by luck, or?
coincidence,
Okay.
complete coincidence. And I found that I really was interested in what the prosthodontist did, but I also realized I didn't know anything about dentistry, and I was really intrigued by it. So
Okay.
I decided towards the end of my bachelor's degree I wanted to pursue dentistry. So I stayed in Boston and I went to Tufts University, to the
Okay.
dental school there. And I worked as a hygienist all throughout dental school, and during that time my interest really evolved into really wanting to specialize and become a prosthodontist.
Okay.
So
Now,
graduated.
how long is dental school?
Dental school is 4 years after your bachelor's degree.
Okay. And then is there, like an MD, there's like a, totally zoning on terminology, like a residency or anything?
You can graduate from dental school and go right off into the workforce.
Okay.
Or you can do a general practice residency, you can do another type of general dentistry residency, or you can go off and specialize. So I decided to specialize.
Okay.
Prosthodontics is a 3-year program, and I went to UCLA for that.
Oh, wow. It's quite a change from Northeastern.
Well, when else are you going to live in California,
That's true.
especially when you're not from there? They also accept only 2 in the country, so it was
Wow.
pretty exciting to get in. So
You go, girl.
thanks.
And what made you come back to the Boston area?
I'm not from California, and my family is
Understood.
on the East Coast, and when it came time to move back, having been a hygienist and having a lot of contacts here,
Oh, perfect.
and besides that, I truly love Tufts. So I wanted to teach, so I teach there now,
Oh,
and I
okay.
work in private practice as well.
Wow. That's pretty intense.
It's a lot, but I love it.
Fun. Okay. Every time you hear the term dentist, people are like, no. Why do you think people have a phobia about dentists? Forget about, going into a specialist.
Well, I think people have a phobia because there's a lot of stigma out there in society. I also think, unfortunately, there's people who've had bad dental experiences. So they take their experience and it carries with them. So I learned actually that about 75% of adults have some form of dental anxiety, whether it's mild or severe. So
Because I've heard friends of mine having to be sedated when they go to the dentist. Ooh.
well,
Have you
it's-
encountered a lot of your patients like that?
Well, I don't do sedation dentistry,
Okay.
so I will.
Oh, you have to go to a special dentist for that?
Well,
Oh, okay.
yeah, you need a little bit more training if you're going to
Okay.
do that. I mean, you can do some oral sedatives and things like that, and I have patients that do that as well. But, generally speaking, it's interesting to sit down with the patient and really try to understand what's going on for them and how we can make them comfortable. And sometimes it's a matter of just taking your time or listening to them or playing a certain type of music. And a lot of times patients, they come around.
Cool. Yay, I love happy endings. Okay, what is prosthodontics, other than being really hard to say?
Prosthodontics is a specialty of dentistry.
Okay.
It's one of the 9 specialties of dentistry, where we specialize in the aesthetic rehabilitation of teeth, whether they're missing or worn or broken down.
Okay.
And we do it with prosthetics, whether it's a crown, a bridge, a partial or a denture, or an implant.
Oh, okay. Because it's like you mentioned crowns, and it's like, isn't there an overlap with regular general dentistry? Because my dentist, is there a competition there, or?
No, not really. I mean,
Okay.
yes and no. I mean, a lot of general dentists do practice prosthodontics. It's not something that there's no overlap.
Oh, okay.
But basically what differs, what makes a prosthodontist differ from a general dentist is that we have 3 additional years of training.
Okay.
And we study diagnosis, treatment planning individually for each patient depending on their current situation. We study dental materials. We understand why things fail. And we also are trained to do more extensive type work.
Okay.
So a general dentist...
Like hockey players. Oh, sorry.
Exactly. A general dentist might feel more comfortable doing a few crowns, maybe
Okay.
some crowns, whereas a prosthodontist is comfortable treating every tooth in the mouth at the same time.
Okay. Now, would someone need a referral to go see a prosthodontist, like from their general dentist, or could they just say, "Oh, my mouth's a mess. I really need to go see a specialist"?
You can come straight to the prosthodontist,
Okay.
and oftentimes general dentists will refer if the case is
Okay.
a little too extensive or there's some reason that they feel more comfortable having the patient see a prosthodontist.
Okay. Now, you mentioned 9 areas of specialty.
Mhm.
Is prosthodontics a newer specialty? How long has it been around as a specialty?
It's actually interesting because not a lot of people know about prosthodontics,
Okay.
but prosthodontics was founded in 1946
Wow.
and was actually
Okay.
recognized by the ADA as an accredited specialty in 1948.
Wow.
So it's been around a while.
Around a while. Yeah. Go figure.
I know.
Now, you mentioned 9. Don't mean to put you on the spot, but what are the other 8?
The other 8. One is endodontics.
Okay, and what's
That's-
endodontics?
That's a root canal specialist.
Okay.
One is periodontics, which is a gum specialist or
specialist,
an
okay.
implant surgeon. Orthodontics.
Okay.
which is-
Oh, been there.
Yes, haven't we all? Braces. Pediatric dentistry, which is
Oh, that's a specialist.
it is. It's
okay.
an actual
okay.
specialty, specializing in children.
Okay.
There's oral and maxillofacial surgery, so wisdom teeth and different types of
Oh,
surgeries and
okay.
implants an oral surgeon could do.
Okay, it sounds kind of reconstructive.
Yes,
Okay.
a lot more extensive than
Okay.
a wisdom tooth removal or a
okay.
simple tooth extraction. There's oral and maxillofacial radiology, which is x-rays and different
Okay.
types of radiology. Oral and maxillofacial pathology, which is,
Like, sounds kind of like cancerous.
yes,
type,
could
okay.
be diseases in the mouth, diseases that are a general disease, but you can
Okay.
find it and diagnose it in the mouth.
Mhm.
An oral pathologist is very useful for that. And public health.
Really? Public
Yes.
health as a dental specialty?
Yes, it is.
I have a friend that works for Harvard School of Public Health, and I didn't know that. Now, is it the same public health, or is it like different?
There's a dental component to
Okay.
public health. So I think a lot of people who are dentists that specialize in public health will end up with a master's of public health,
Okay.
but they would know much more than I do about it.
Interesting. Very good for even being interrupted, still able to list all 9 of them. I'm impressed.
Thank you.
Don't ask me to repeat them. Now, I think you kind of already covered this. Is there anything you wanted to add about how a prosthodontist is different? Now, do you cover general dentistry as well, or just the specialties?
I practice pretty much prosthodontics, but if there's something that's restorative in nature, I would still do a filling for a patient or something
Okay.
like that. So if there's something that I'm comfortable doing,
Okay.
I'm more than happy to do it. If a patient of mine needs a root canal, I'd much prefer send them to the endodontist than have me do the root canal
okay.
because they're better at it. The patient will
But you
have-
could do one if you had to.
I could do one if I
Not to
had
put
to.
you on the
I
spot.
could do one if I had to, but I definitely would prefer
easier
my
to-
patients are in better hands with
Yeah.
an endodontist, without a doubt. I haven't done
I'm just
it.
kind of curious about like the training. You know, if you have to go through, like, would a root canal be considered like the general dentistry, and then you go on to the specialist?
Well, we're taught to do it in
Okay.
dental school, so dentists can do a root canal.
Okay.
However, sometimes roots are really curved,
Mm.
and there's sometimes in the root of the tooth are actual canals of the nerve, and sometimes there's
okay.
more canals than expected, and sometimes there's little branches of canals that are not expected, and so that's where a root canal specialist comes in, because they can actually use a microscope, so they
Oh,
can
wow.
look down into the tooth,
Okay.
and they can see much more than we
Now,
can
would you
with
be
our
able
eyes.
to tell what the scenario might be through a regular X-ray, and then?
Not always.
Ah,
Sometimes
okay.
you need to get in there and see what's going on.
Okay.
An X-ray is really a two-dimensional picture of a
Okay.
three-dimensional situation.
Hmm.
So sometimes you just need to get in there and see what's happening.
Hmm.
Exactly.
Wow. A microscope in your mouth.
hmm
That sounds pretty high tech.
It's very high-tech, and it's really, really useful, and it's providing a much better service to patients. So technology is a good thing.
Wow. Okay. How do you know that you need to see a prosthodontist? I knew I'd screw that up.
If you basically, it can be as simple or as complex. If
Okay.
you are a really aesthetically demanding patient and you really, really want to have optimal aesthetics,
Okay.
prosthodontists tend to know materials a lot more extensively than others.
Okay.
We also tend to work with really, really successful labs and
Okay.
really skilled lab technicians.
Oh,
So
okay.
we kind of,
Now, at your practice, do you have a lab based in your office, or is it like, do you have to send
we
stuff
actually have a
out?
lab technician that comes into our office to take custom shades. So say if I need something specially matched, I'll have the lab technician come in. I also work with an amazing master ceramist in California that I've been working
Wow.
with for a while, and he's terrific. We also take a lot of photographs,
Okay.
so we can translate any information to where it needs to go.
Oh, okay. Well, I believe we have a call.
We do.
We do. Can you hear us? Hello? You still there?
Hello?
Hi.
Yeah. I got a question for you. My,
Pam?
I have currently 2 dental implants, and I'm in the process of getting my third. And the second implant I had was a front tooth, which was a shame that I had to lose because there was mobility in that tooth. And when they took an X-ray, they found that the root was cracked below the gum line, so I had to lose a perfectly good tooth. But I started on immediately getting an implant. This was about 7 years ago. And I went through, literally speaking, purgatory on earth to get a dental implant with my front tooth. I already had one previous implant with an eye tooth. And, that was a bit of an ordeal, but the front tooth was, really, like I just alluded to, purgatory on earth. Now, this other implant, I'm in the process. I already have the basic hardware below the gum line. So far, that went smooth as could be. The reason why I'm having a third dental implant, that tooth, they were going to do a root canal, but the dentist that was one of the specialists that does root canals found that the teeth were all, the roots were all calcified, and that unfortunately I had to lose that tooth.
So do you have a question for us, or when are you getting your third implant taken care of?
Yes. And in fact, I was really excited, going to the dentist, having the basic hardware installed in my mouth for my third dental implant. Now, in another month or so, I go back to have it, reopen, and they're going to put in some healing devices. Then probably sometime this fall, I should have a finished product.
All right. Well, best of luck to you, Greg, and thanks for calling in.
Okay.
Good luck.
And, Linda, I have a suggestion for a program you might want to do in the future is one on eyes, because I have inocular implants, and I know it was like Toulouse eyesight, but thank goodness for medical science these days, I did not have to go blind.
Oh, excellent. Yeah, that is a good idea. I was actually thinking about that earlier today. Great idea, Greg. I will look into that. Thank you.
Okay.
Now, is Greg's story typical of the average patient?
Yes, it is. Basically, you have a tooth, something happened to it, whether it's been traumatized or you had a cavity, or there's something that has injured the nerve of the tooth. And
Okay.
sometimes recurrent trauma, that kind of thing, can make the nerve itself kind of calcify.
Okay.
So then sometimes you lose part of the tooth, or we need to build something on top of the tooth.
Okay.
And you need to have a minimum amount of tooth to build
Well, yeah,
upon.
there's got to be something there to work with.
Exactly. And sometimes if you don't have enough tooth, you can have a root canal done so that we can build something, use the root as an anchor
okay.
to build something on top of it. But if the root canal is not possible and there's not enough
okay.
tooth to build upon, then sometimes, unfortunately, we lose teeth. But he did the best thing he could possibly do by getting implants, and although his first experience wasn't a good one,
Second one was.
and he came back for a third time. So I think that's a positive at the end of the story.
Right. Now, I did have a question for later on, but it kind of, Greg's story kind of spurred it. What are the advantages of dentures versus dental implants? Advantages, disadvantages of both?
Well, basically, it depends on the situation.
Okay.
If you're missing one single tooth,
Okay.
your options for replacing it is a bridge, which you're sacrificing the two teeth next to the missing tooth
Okay.
to replace that tooth. So the thing that's nice about an implant is that you can
Just do
do one tooth and
okay.
just deal with that one localized location. If you're missing many teeth, if you have enough bone, implants are the most ideal option because it restores most of your chewing ability.
Oh, okay.
But sometimes when you don't have a tooth, the bone itself starts to collapse. So you need to have a minimum amount of bone to hold
Okay.
an implant. So if you don't have enough bone, or for some reason you have a medical condition that won't allow you to have an implant surgery,
Okay.
then a denture is a better way to go.
Implants, just the thought of them sound kind of painful. Do you know if they are?
They're actually not painful.
Okay.
They're about as, I would say taking a tooth out in some instances is more uncomfortable than having the implant placed.
Oh, okay.
So an implant
So
surgery.
I've seen like pictures on your website and other websites, and I'm like, ooh, I just can't imagine that being done to me.
Well, you're numb the entire time.
Okay.
You're working with an experienced surgeon. They can get the procedure done as quickly and painlessly as possible, and you get your tooth back.
Oh,
So it gives you
excellent.
a second chance of having a tooth.
Wow. And go figure, we actually have another caller.
Wow.
Isn't that cool?
This is exciting.
All right, can you guys hear? Can you hear us, caller? Are you still there? Okay, well, hopefully we can't hear you, so if you want to try calling back, we'd be happy. Oh, wait. Do we have someone? Okay. If that person still has their question, they could call back, but seems to have some technical difficulties. Okay, well, thank you about that. Now, what kind of general care do you suggest to avoid having to go see a prosthodontics? Not that we don't want to see you, but
That's okay.
much rather see
Nobody-
you on TV than have to go see you at work.
Yes, not many people like to see me at work, unfortunately. Well, to avoid having to see a prosthodontist, an ounce of prevention is worth a pound of cure. So seeing your dentist regularly, catching problems early, having excellent oral hygiene, and if you have a tendency to clench and grind your teeth, wearing a protective night guard.
How do you know you grind your teeth?
Well, sometimes, let's put it this way, the only time your teeth are actually supposed to touch each other is when you swallow. And that equals about 20 minutes a day.
Okay.
So if you're reading during the day or you're focusing and you're holding your
Okay.
teeth together, your teeth are actually not supposed to be touching.
Because I'm just thinking like a lot of people grind their teeth at night, and I'm thinking, how do you know that if you're asleep?
Well, you can wake up with sore muscles.
Okay.
That's some way that you may notice. Also, if you happen to sleep in bed with a spouse or a partner, they may hear you grinding your teeth.
Oh, okay.
And that's a pretty awful noise that they will tell you about. So that will tell you that you need to get to the dentist and
What
have
were
a
you
night guard
doing?
made. Exactly.
Now, I think we might have a caller this time.
Okay.
Let's see. Do we have a caller? Can you hear us? Take two. Okay, don't hear anyone, so maybe they'll try again. I love these technical issues. Okay, so would part of that preventative program be visiting your dentist every 6 months, every year? Is it really necessary to go every 6 months?
It depends on the person and it depends
Okay.
on the case. Generally, it's every 6 months. That's a
Okay.
good generality. However, some people require coming in more frequently, whether it's 3 or 4 months.
Okay.
You have to have
Because like my dentist won't let me out of the office until I book my next appointment in 6 months. And I'm like,
I know. You know what? It's so
I
important.
can't forget. You won't let me forget.
We will not let you. We will find you. We will
We'll
find
hunt you down.
Exactly, because we care about your health.
And you know where we live.
And we know where you live.
Okay, how often should you brush your teeth? I know it sounds really trivial, but when I was growing up, it was after every meal and before I go to bed. And then someone told me, oh no, if you brush too often, you could wear away the enamel on your teeth. And now, like, my kids are watching Super Y, and it's like, brush your teeth 2 times a day, and it's like 2 to 4. What is the general practice now?
Generally, you're going to recommend that people brush 2 times a day.
Okay.
Now, most of the time when people wear away their teeth, it could be because of improper toothbrushing technique
Okay.
or using a toothbrush that might be too hard.
Okay.
So if you're pushing really hard with the toothbrush, or you're using a hard or a medium toothbrush, yes, you got to use soft or extra soft. And what's most important is that you spend more time than more pressure.
Well, I do have a Sonicare now, but I think it comes
Good.
from, when I had braces, you really had to
Well-
because I had the metal bands with,
Oh, yeah.
braces from the 1980s.
Well, if you have braces or you have Invisalign, then brushing your teeth more often would actually be recommended.
Okay. Well,
So-
okay, we're going back 30 years, but I remember, I think I just got in the habit of really grinding. Phone call, take 3. Caller, can you hear us?
Hello?
Hi, yay!
Can you hear me?
Yes, I can. Thank you.
Hi.
Do you have a question
My
for
name
Pam?
is Lisa,
Hi,
and
Lisa.
I couldn't be more happy that I happened to turn into your show this evening.
Do you have a question for Pam? Lisa, can you still
Are
hear
you
us?
still there?
Yeah, we're still here. Do you have a question, or are you just calling?
I
to let us
do.
know?
I am 28 years old, and I just graduated from law school, and I have a question that's been on my mind. I was in my early teens when I had braces put on, and I got picked on quite a lot and called brace face, and I just wanted nothing to do with them, and I ended up taking them off on my own. My friend and I, we scraped them off. We took them off with pliers. Thought it
Ow.
was a great idea at the time. Didn't realize how it ruined my teeth. I then moved out at an early age and took a wrong path, and have then gotten myself on the right path. And all of my time, all of my finances have been put into putting myself through law school, getting a degree, graduating at very top of my class, top 20%, and I'm now ready to look like the professional that I know I am. As of right now, I'm embarrassed to go to interviews. I have black spots, and my teeth look cracked. They're all over. It's all over my front teeth, and I actually don't smile. I'm embarrassed. I'm ready to regain going back to the dentist, and I want to know what a prosthodontist, how you would help me versus my general dentist, who I haven't seen in over 10 years.
That's an excellent question, and you really should be applauded for all that you've accomplished. It's pretty
Yeah,
amazing.
that's amazing.
It really is. Well, basically what a prosthodontist would do is we'd look at you very comprehensively. We would start with radiographs and photographs and a complete comprehensive exam, and I would have you back to sit down and go over all of my findings, both on your x-rays and on your photographs, and present a plan to you. And you're telling us that you have multiple teeth that are a problem, and that's exactly what I would do. We would come up with a plan where we could address all of your teeth at one time, and we would go from there.
Do I have options, or what should I expect for treatment options? What could you do?
Yeah, could
as
you
a
do something like
prosthodontist?
on the surface, or would she have to be more looking at implants? Do you know if it's just a surface thing?
If it's just a surface thing, it might be something that's easily filled. You might need a veneer, or you possibly might need a crown. If something's broken badly enough, perhaps you would need a tooth taken out and an implant placed, but it's really hard to comment without actually seeing your teeth. But absolutely, your prosthodontist or anybody that you'd like to see would take a look at you and, of course, would offer you treatment options. We would offer you an ideal treatment option and then various acceptable options from there. And it would be a decision that you and your dentist really need to make together, because just as you've invested in your education, it's time to invest in your health. And it's something that you need to feel emotionally and financially invested in. And it's a decision that you make with your dentist, and it's something you do together as a team.
If I needed multiple caps on my teeth, do I have to make a separate visit for each one?
No, actually, you could sit for possibly a long appointment if you're able to do that, and we can prepare all of your teeth in one visit. I don't make crowns the same day, but I would see you, I would prepare all of your teeth, and you would leave with temporary crowns, which would be as close to an exact prototype of what your final crowns would look like.
Wow. Okay. And what is if I hear about a veneer? I think they're called. Is that an option, or what are they? Do prosthodontists do that, or is that a general dentist thing?
Some general dentists do veneers, prosthodontists do veneers. What a veneer is basically like a surface refacing on the tooth. So if you have, say, an enamel defect, just an outer surface defect on your tooth, or your tooth is too narrow or needs to be recontoured in such a way, a veneer might be an option for you. But again, unfortunately, without seeing, I wish you were here right now so I could look at your teeth and tell you, but we would really have to see your teeth first.
But a veneer is like something that's put over the existing tooth. It's not just like filling in the...
No, it's almost like a Lee press-on nail for teeth.
Okay, excellent.
But a little more permanent.
Little better.
Okay, well, excellent. I really appreciate your time, and that's fantastic. At least I know where to start. I appreciate your information.
Thank you for calling.
Now, if Lisa wanted to, could she make an appointment with you either by calling or emailing you or something?
Absolutely.
Or if she wanted somebody closer than downtown Boston, would you be able to recommend is there even a prosthodontist in the Burlington area, do you know?
There are prosthodontists, actually in the greater Boston area, there's a lot of them.
Okay.
So if you're looking for a dentist in the area,
Okay.
if you're looking specifically for a prosthodontist in the area, the best place to start is the American College of Prosthodontists website. There's actually a website where you can put in your zip code and they can tell you all of the prosthodontists in the area. Another way is Google. You can Google prosthodontists in a town and something will come up, and then it's a little more research to evaluate their website and possibly reviews. But I think as a patient or as a consumer, before you even do that, it's important to sit down and think, what's important to you? Some patients say, I want somebody who's going to accept my insurance. That's all I want. That's all I care about. And that's great, because there's dentists that can help you.
Okay.
There's some patients that say, gosh, I really want somebody who will take time with me and listen to me. And there's dentists that will do that as well.
Okay.
So
sometimes they'll actually do both.
Some will do both. So basically, once you determine what your values are and what's important to you, do a Google search, start looking for dentists or prosthodontists in your area, and then look at reviews and look them up and research their background, and you'd be surprised. There's actually a lot of them around.
Okay, and you could probably also talk to your general dentist for recommendations to a prosthodontist as well.
Absolutely.
Okay, great. Hopefully we answered all of Lisa's questions.
I hope so.
But glad she called in.
I am too.
Thank you, Lisa.
Yes.
Okay, back to general oral care, avoiding having to see you in a professional manner. We talked about brushing too hard. Are there certain toothpastes that should be avoided, like those whitening toothpastes and over-the-counter whitening things? Should those... Anything over-the-counter just seems a little questionable.
I think it's very important to consult your dental professional.
Okay.
Whitening products themselves, they will whiten your teeth one of two ways. They're either abrasive, so they'll rub the stains off of your teeth, or there's a bleaching agent in them, and they'll actually whiten the surface of your teeth. So it's important to determine which way or which method the whitening actually works.
Okay.
So that's basically how your toothpastes will work.
Okay.
The ones that are abrasive, in some instances, are quite abrasive. So I would visit with your dental hygienist or your dentist and ask them whether or not they think the toothpaste itself is safe for you. Over-the-counter whiteners, once again, you're going to want to consult your dental professional because there are some that are safer than others. Generally, you want something with a lower type percentage of whitening agent, whether it's hydrogen or carbamide peroxide. And a lot of the Crest products or Rembrandt products are safe. So I say, as a first line of defense, start with one of those products. And then from there, if you want a little more bang for your buck, come into the office and we can help you with either an in-office treatment or take-home bleaching trays.
Thank you.
You're welcome.
Okay, best practices for preventing cavities. Now, I have a friend who's convinced that he has a lot of cavities now because he ate candy as a kid. Is that true?
He probably wouldn't have cavities today because of something he did a long time ago. It could be a process that's happening. The best way of preventing cavities is seeing your dentist regularly and your hygienist regularly so that we can catch the problem early. And I'd much rather do a small filling than a large filling, and I think most patients feel the same. There's a new approach that came out about 2007, and it's called CAMBRA. It's called Caries Management by Risk Assessment. Caries is tooth decay or a cavity. And basically what that is, it's an approach as far as how to prevent tooth decay. And it's wonderful because you assess a patient's risk. So we look at why are you getting cavities and what we need to do to minimize your risk for getting cavities. So sometimes it includes behavior management. If you're a big candy eater, eating candy is not necessarily a bad thing. If you're doing it all day, that's usually not a good thing. But if
and
you
not just for your teeth either. It's
not just
good
for
the
your
rest
teeth,
of you.
Exactly. But definitely, it could be something that we can help you with strategies so that you can still eat candy but keep your mouth healthy. So, assessing risk, assigning you to a risk category, whether you're low, moderate, high, or extreme, and then helping you with accordingly. It might be an antimicrobial, something to kill the bacteria that causes tooth decay. It could be behavior management, as I had mentioned. It can also be the use of products that contain Recaldent, which is a calcium and phosphate product, which is the mineral that your teeth are already made up of to help put the minerals back into your teeth, and of course fluoride.
Speaking of fluoride, recently I've heard pros and cons about fluoride in water systems. I know I didn't clear this question with you, so feel free to say I don't want to answer that. Are there benefits or disadvantages of having fluoride in a town's water supply?
There's actually a lot of benefit to having fluoride in your water supply, especially if it's put in as a deliberate act, because it needs to be a certain percentage or certain parts per million for it to be safe to be ingesting. So especially for children, for example, you want to have that magical number where you're ingesting it and you're getting the systemic benefit, meaning that when the teeth are actually developing, the enamel is getting built as the teeth are developing, versus the topical effect just by drinking it and having a fluoridated water rinse over your teeth.
Now, do water filtration systems like Brita or Pure, do they take out the fluoride?
Some of them do, yes.
How would you find out? Is it like on the label on the side, or?
Sometimes it's the label, sometimes you need to call the company. Or look online. Oftentimes, Google has answers to everything.
Gotta love Google.
Good old Google.
And they have fun little animations sometimes. So you find out historical events while finding out if there's fluoride in your water supply.
Exactly.
Cool. Now, did we finish the discussion about brushing your teeth twice a day versus 4 times a day?
I think so.
Okay. Because I think that's what we were talking about before Lisa called, and I just wanted to make sure that we finished everything if there was anything you wanted to add.
Basically, as a generality, twice a day using a proper brushing technique.
Which is?
Which is light pressure and the appropriate amount of time, which as a generality, it is 2 to 3 minutes. And you want to kind of systematically work your way around your mouth so that you catch every surface of your teeth.
Is it still up and down?
I like the Bass method of toothbrushing, which is a 45-degree angle to your gums, light pressure, and kind of jiggle the brush back and forth. About 10 seconds per area, so you kind of go back and forth, count to 10, and move on and do the same thing. Or if you have an electric brush, hold it there for 10 and move around.
I just kind of, hold it there. Maybe not for 10, but then I go back around and kind of get bored. But yeah, I was just thinking of, whether it's up and down. I came up with a little rhyme when brushing my kids' teeth. Brush up and down, brush your teeth up and down and round in circles. Oh, wait. What is it? It's up and down, back and forth and round in circles. And I figure if you do every direction, it's got to be good, right?
It's got to be good. If you hit every surface, you're not going to hear me complain.
Okay. Yeah, I'm still a little reluctant to let my kids brush their teeth on their own because I'm afraid they're not getting all the areas that they should.
Well, I think a good
When
technique...
do you start trusting your kid?
I think a good technique is, and I'm not a pediatric dentist, but I have read, and this is what I see my sister-in-law and my sister do with their children. You give them the autonomy to brush for a couple minutes so that they feel like they're doing something, and then you go in and do everything else.
That's what I'm doing. Okay, you get a turn, now mommy gets a turn.
Exactly.
Make sure to get the, because last time my daughter was at the dentist, the hygienist actually showed me. She's like, well, you're missing that back corner there. So I have to tell my kid, okay, open wide, relax. So we have an appointment in a couple of weeks, so hopefully we'll get a better review this time.
That's good. They also have different types of tablets or solutions that you could go home with to actually put on their teeth that clings to the plaque.
Turns red?
There's red ones. There's also one that I love. It's a tricolor one that will turn either purple, blue, or pink depending on the type of plaque that are on your teeth.
There's different types of plaque?
Yes. Well, there's plaque that's been there for greater than 48 hours. There's plaque that's been there for less than 48 hours. And there's plaque that specifically causes tooth decay. So it's interesting to see what types of plaque are on your teeth and where you're missing so that you can brush better.
I remember having that in like 6th or 7th grade, the little red tablet, and it's like, ew.
They're still out there. But they're
And where do you get those? From your dentist or?
A lot of times from your dentist. You might be able to find one every once in a while in CVS, but
Okay.
I'd say start with your dentist because they tend to have the best products.
Cool.
They're really cool.
Not that I want to color my teeth purple, but just think it might be kind of fun. Make sure I'm brushing correctly.
Absolutely, it's an education.
Now, what is more important? Taking care of your teeth or taking care of your gums?
Oh no, that's like asking me who do I love more, my nieces or my nephews? Basically,
Trick question.
they're both so important. You
Okay.
really can't have one without the other. So as you're brushing your teeth or cleaning in between your teeth, it's important to keep both in mind. Because if you don't clean around the gum line, yes, you could have gingivitis or gum disease and lose bone around your teeth, but you can also develop cavities in those areas as well. So as far as I'm concerned, they go hand in hand and they're both equally important.
Okay. Just came up with a little anecdote as well. I'm full of these. You're probably sick of hearing anecdotes about dentists. Flossing. I know it's very important. How come the hygienist always says, are you flossing? Because obviously they can tell if you're not. Are they testing you to see if you're going to lie to them, or can you really not tell? Are you flossing? Uh-huh. Well, you're not flossing very good. It's...
Well, it depends. If we say, are you flossing? We see that there's probably some gingivitis happening in your mouth.
Okay.
So perhaps if you say, yes, I floss every day, and we still see that your gums are maybe a little bit inflamed or they
Okay.
might be bleeding, then perhaps you're missing something, or perhaps you're not using the right floss for your mouth.
Okay.
So if you say, yes, I'm flossing every day, that's not expected for somebody who's flossing every day. So we need to either modify your technique or the products that you're using.
Okay.
Or if you say, nope, I'm not a flosser, well then what we
need
see
to be.
matches what you're doing.
You need to. I thought it was like a trick question or something. Going, do I say yes? Do I say no? What do I say?
I think it's so important to be
Pressure.
honest. I know. And I think, my gosh, patients, they don't want to
put
disappoint
you
you.
on the spot, but it's just like, you're gonna hurt me if I say no.
Never. We just want to be able to help you to attain oral health. That's all.
Okay, now we talked a little bit after Greg called about dentures versus dental implants. Are there target audiences of one over the other? Like, does it tend to be older people who get dentures and younger people that get implants? Or is it men versus women? Is it, certain teeth? Is there?
Not really anymore.
Okay.
Basically, implants versus dentures, if we're talking about somebody who has no teeth, and say they've had no teeth for a long time, and they've gotten along well with dentures, then they tend to be a little bit more reluctant to move forward with something like implants, whether or not they'll change their life and improve their quality of life or not. However, when people are faced with losing their teeth, nobody really wants to lose their teeth.
Right.
So those patients tend to say, I really want to look for a more permanent or a fixed solution, something I
Okay.
can't take out of my mouth.
Okay.
So then we possibly look at an implant solution for them before they even have their teeth taken out.
Okay. Now, are implants permanent? Or do they only last 10 years, 20 years, lifetime?
Well, there's a few components to an implant.
Okay.
The dental implant itself actually gets placed into the bone surgically, and the bone actually fuses to the implant. It's called osseointegration.
Okay.
And that implant should hopefully stay there for the rest of your life.
Okay.
Now, depending on if you have a denture that snaps into place or we have a crown that we place over that implant, there's
Okay.
complications that can occur with those, and they may require some maintenance, but the dental implant itself that's in your bone will hopefully last you your life.
Okay. Because I'm wondering, obviously you still have to take care of them, but I'm wondering if there was a life expectancy where you have to get your implants, the visible part, replaced after a certain number of years.
It's not necessarily replaced after a certain number of years.
Okay.
We would check you periodically, just as if you had your
'Cause they
teeth,
could
we'd
still
still want
crack
to
or
see you.
something. Okay.
Absolutely. Teeth tend to wear, parts can loosen, so we want to make sure if there is a complication that we catch it early so that we
Okay.
don't affect the implant itself and do any type of maintenance or fixing type procedure.
Obviously, implants can't get cavities, but could there be a gum infection potentially? So they'd still need, or infections getting under.
You can.
I'm coming up with hypothetical things that are never going to happen.
No, it's a great question, and it's actually possible. So because once you have bacteria in your mouth, the bacteria can proliferate and sit on anything that's in your mouth.
Okay.
So if you don't clean a dental implant, you can have gingivitis, or
Okay.
you can have what's called peri-implantitis as opposed to
Okay.
periodontitis or gum disease.
Now, are there special, instead of just brushing your teeth, are there extra things that you have to do?
Depending on the type of implant prosthesis or restoration that you have, sometimes you use a floss that's a little thicker.
Okay.
Sometimes you'll use a brush, it's shaped like a Christmas tree, and then it's on a handle that you can kind of use and go around and
Okay.
use. Sometimes it's a matter of brushing and flossing. So again, it's really important to have individualized instructions for your own specific situation.
Okay. And do dentures, on the flip side, do they have a life expectancy where you have to get those replaced every so often?
Complete dentures,
Yeah.
basically, yes.
Okay.
They last about 5 to 7 years.
Okay.
Because bone, it's alive, and bone itself can actually change. So the denture teeth can wear, and
Okay.
as denture teeth wear, you're not putting even pressure always on
Okay.
those dentures, and dentures kind of operate as a single entity. So if you're putting more pressure on your denture, then you can actually have more bone loss in that area. So it's important, again, to continue to have maintenance and have your dentures checked.
Okay.
But generally 5 to 7 years,
Okay.
although I meet patients that have had them for 30 and they're happy as a clam. So
Because I'm just wondering, again, if you were put in the situation, would that could be a deciding factor, or not necessarily a deciding factor, but it could weigh in the decision-making process.
it could weigh in the decision-making process. Also, people say, gosh, these dentures don't stay in well. And as I'm talking, they're moving around.
Okay.
If that happens, then implants might be a good solution because they can snap the denture into place.
Okay.
Or if you have a few more implants, you could have dentures that you don't remove.
Oh, that's an option too.
It is an option. There's a lot of options.
Wow. So we'd have to come and talk to you.
Yes.
Okay, I think we talked about this a little bit when Lisa called, but what are veneers and when are they the best course of action?
Veneers are a great option because it's a pretty conservative way to restore a tooth.
Okay.
A veneer is basically a really thin shell of porcelain that gets
Okay.
permanently cemented on the front of your teeth. So it's
Just the front or the front and the back?
it's the front, and it kind of hooks over the back.
Okay.
And so It will make a narrow tooth look wider. It can make a really rounded tooth look more square, so it can change the contours of the teeth.
Can they make teeth look straighter?
Yes, it can. Veneers can make teeth look straighter. However, if you want my personal preference, if your problem is crooked teeth, the way to fix it is to straighten them. So I would rather see somebody have braces than commit their tooth to a permanent restoration when braces could be, even though it may take longer and you'll have braces, it would probably be a more conservative long-term solution.
Okay. Speaking of braces, what are the pros and cons, braces versus Invisalign?
Well,
Because again, like Lisa suggested, people could see the braces and that caused her stress, where Invisalign, nobody can see them, so.
well, there's pros and cons to both. A pro for braces is that you can't take them out. And regardless of what you're doing during your day, your teeth are moving in the direction that your orthodontist wants them to move. The con is that you can't take them out. And therefore, you're going to parties and weddings and business meetings and you have braces on your teeth. Invisalign's a great option because they allow you a little bit more flexibility with that. But what's most important is having your orthodontist decide whether or not Invisalign is right for you. Because Invisalign is not the same as braces, and it can't do all of the same things that braces can do. So it's important to have the orthodontist take a look at your teeth and decide whether or not Invisalign's an option for you, or if your case is better suited for fixed braces.
Would one of the cases where braces would be better is if there is a long distance for the teeth to move? Like if your teeth are really messed up, or if you have an overbite or crowding or whatever?
If there's a lot of
Invisalign's
difficult...
are more for minor changes?
If there's more difficult movements, say if you have a molar that's tipped and we need to move a molar, something that's requires a lot more force on the tooth, a fixed braces would be a better way to go. But Invisalign, there's a lot of flexibility with it, and it's getting better and better, so that Invisalign is able to do more and more. However, again, I like to leave those decisions to the orthodontist.
They went to 3 years of extra school to learn about this.
Exactly.
Go talk to them.
Exactly. They study anatomy, they study your skeletal relationship of your upper and lower jaws, they study how your bite is supposed to be. So they're really, really important when it comes to deciding whether or not braces or Invisalign's the way to go.
Speaking of orthodontists, another story about me. We talked back earlier in the show about anxiety when it comes to dentists. I have major anxiety when it comes to talking about orthodontists. Because I did have braces back in high school, and right when I had braces and when I got them off, they caused me to get TMJ, or some kind of partial dislocation in my jaw. Can a prosthodontist treat TMJ and correct the damage that my orthodontist did?
Yes. Basically, prosthodontists, we specialize in the bite, and we treat various bite issues, and that's something that we definitely do. I would make a night guard that puts your bite in a comfortable position, and sometimes that's enough, and sometimes that's all you need. Sometimes you may need warm compresses on your joints, sometimes steroid injections, and you would need to see if that prosthodontist is comfortable doing that. If they are not comfortable doing that, then there are people that I would say concentrate on TMJ. And so I would send you off to a TMJ type clinic if it was beyond what I was comfortable doing.
Speaking of TMJ and night guards, can a prosthodontist fix snoring? Sometimes, assuming it's not like an apnea thing, or can you fix an apnea thing? Or
yes, you can. I would not touch a sleep apnea patient without consulting with the patient's physician. So it's important that we work closely with their physician to understand, yes, it's sleep apnea. Can it be corrected with an occlusal appliance, meaning something that you wear in your mouth, or is a CPAP machine necessary? So without that diagnosis and the course of action, it would be something that I would work closely with the physician to make that decision. But there are devices that can be made to make patients more comfortable, help with snoring, and hopefully sleep apnea as well.
Now, just kind of thinking anecdotally again, the guards for helping with snoring. There are some that you can get, as seen on TV for $30, and then I went to talk to my dentist, and he's like, yeah, it's a $700 fix. 30 and 700 seem to be a big difference. What are these differences? Are the as seen on TV ones legitimate?
I would not put something in my mouth to treat a condition that
You saw on
is
TV.
not done by a dentist, no.
Okay.
Truthfully, if you're having a sleep apnea problem or a snoring problem, it's affecting your airway as you're sleeping. So it's a pretty serious condition. So I would absolutely have something made by a dentist.
Okay.
If you can imagine, it's everything we do in dentistry, and I know I have this conversation every day with my patients about the cost of dentistry. But every single thing that we do, it's fabricated with our own hands,
Okay.
and it's custom made for you,
Right.
for your situation. So it's obviously going to cost more. The materials are better. It takes more time to make, but it's specific for you and will hopefully help you. Sometimes devices that are purchased in the store may help some people, but it could also make some people worse.
Yeah, that's
So
true.
it's nice to have people treating you who have science behind you and some education as far as treating those conditions as well.
We talked about the 9 different specialties. We only have like less than a minute left.
Wow.
Okay, maybe we should skip that question. Now, how do you find a good dentist? What are the steps to find the right dentist for you?
I think finding what's important to you is important. And then I say either word of mouth. Word of mouth is very, very powerful. If you had a great experience with your dentist and you have friends and family that are just like you, they will probably love to be treated by the same dentist as you.
Okay. Excellent. Well, we do still have more time. I can get my last question in. What are the advantages of bringing children to a pediatric dentist? Like my dentist says, sure, bring your kids in, but he's just, well, not just a general dentist, but should I be bringing my kids to a pediatric dentist?
It's the same scenario as a prosthodontist versus a general dentist. A pediatric dentist has 2 or 3 years additional education in growth and development, pediatric behavior, materials, techniques, procedures, etc. So not every child needs a pediatric dentist. If you have basic dental needs, a general dentist is more than suitable, and they will take excellent care of your children. However, if you have a child that might be fearful or might need a little bit more time or may have extensive dental needs, for example, if a baby goes to sleep with milk in a bottle, they often have extensive tooth decay. So a pediatric dentist might be a better solution for your family.
Okay. Well, we are just about out of time. So thank you so much for coming on.
Thank you for having me.
And hopefully we will hear from others. I'm so thankful that we had some people call. And hopefully we'll have you on again.
I would love to be back.
I'd like to thank everyone for watching. And please feel free to check out the BCAT website to find out some of the other topics that are covered on this show. Feel free to email me at talk@bcattv.org. And have a pleasant evening and a wonderful week. Stay cool. Thanks.